Welcome to the Expert Committee on Clinical Events Assessment following COVID-19 immunization media session. We have with us co-vener of the Expert Committee, Professor Ivan Hong, and Dr. Lee Kwok, and Assistant Director of the Department of Health, Mr. Frank Chan. Let's hear from Mr. Chan first. Good evening. I'd like to quickly say that the Expert Committee will report on some cases today in relation to the use of Comirnaty. Out of caution, the vaccination of Comirnaty will be suspended. However, we will not answer questions in this regard here. Good evening, everyone. We'll now go through some death cases. The first one is the one on the 2nd of March. It's been announced. It involves a 63-year-old male who has received treatment in Queen Elizabeth Hospital, and on the 28th of February passed away. The autopsy has been completed. The cause of death is acute myocardial infarction causing acute pulmonary edema. In relation to other test reports, there is no indication of immunoreaction relating to the vaccine. We apply the algorithm and determine that the death of this male has an inconsistent result with causal association to immunization. The 5th case was announced on the 13th of March, involving an 80-year-old male who stayed in Caritas Medical Center for treatment, and on the 13th of March died. According to the medical report as well as preliminary autopsy report, the male died because of acute myocardial infarction causing acute pulmonary edema. There is no direct link with the vaccination. We have to wait for the full autopsy report before we give you further information. The 3rd death case chronologically is the 7th case. It was announced on the 13th of March, involving a 63-year-old person who received treatment on the North District Hospital. The patient died on the 14th of March. That male, because of heart failure, died. The committee thinks that there is no direct link between death and immunization. We will wait for the full autopsy report before giving you further information. The 4th death case, chronologically, is the 8th case. It was announced on the 19th of March. It's a 66-year-old man receiving treatment at the Alice Homeo Link Netherso Hospital, who died on the 19th of March. On the 16th of March, he received the first dose of Comirnaty. He's suffering from diabetes, hypertension, and hyperlipidemia. The preliminary view of the expert committee is that it is not necessarily linked to vaccination. However, we have to wait for an autopsy before giving further information. The next case is the 9th death case. Chronologically, is a 80-year-old person suffering from diabetes and hypertension. On the 19th of March, she was found to have fainted at home, and there is no sign of life on the ambulance. She died in the Queen Mary Hospital. 17 days before death, that is the 2nd of March, she received a dose of Sinovac. According to preliminary autopsy, it's found that she's suffering from coronary disease with problems of the heart, arrhythmia, as well as coronary vascular diseases. The committee is of the view that the death of this case is not directly linked to immunization. Today, we have received another death case reported by the Department of Health involving a 60-year-old male who is suffering from diabetes, hyperlipidemia, as well as aorta diseases. On the 13th of March, he felt discomfort at the chest and was found to have fainted at home. He's sent to the A&E department of Yanchai Hospital and later pronounced death. 13 days before he passed away, that is on the 11th of March, he received a dose of CoronaVac. That's all the information we have in relation to this case. We need further information before we can conduct a causality assessment. In the meeting today, we've discussed altogether 9 preliminarily Bell's palsy cases. They are all male, aged between 39 and 86 years. Of these cases, 8 of them have received a dose of CoronaVac, 1 Comirnaty. The committee will continue to monitor these cases. Should there be any irregularity, we will advise the authority to take proper action. Say, for example, to ask the pharmaceutical company to properly change the product information. I'd like to also report one case of a serious reaction. It's a 35-year-old female on the 15th of March received a dose of Comirnaty. 5 minutes later, there were rashes, short of breath, as well as palpitation. Preliminary diagnosis is a serious reaction. She received treatment at the Prince of Wales Hospital and was later discharged on the 18th of March. We will refer the case to allergy clinic. Of the serious reaction cases, it's about 0.8 cases over 150,000 Comirnaty doses. It's similar to other places. Out of 100,000 doses, there are about 2 to 4 cases. Today, the expert committee has also discussed about the latest clinical report as at the 21st of March. On the 26th of March, the report will be disseminated on a dedicated website.
It's now question and answer time. Please indicate your agency before you speak, and please do not ask more than 3 questions. The gentleman on the other side. Good evening. I'm from Commercial Radio. I'd like to ask about the total numbers of deaths. You mentioned 2 new deaths. Please let us know which vaccine they received. Are there now a total of 10 death cases? Secondly, this morning, there is a stoppage of the Comirnaty vaccination program. If people cannot get a booster shot after 21 days, when can they receive the shot? Will there be a contingency plan? If the latest is 42 days after the first shot, and if still at that time there are no Comirnaty shots available, then what will be the advice of the experts? Do people have to start all over again, or they can go for a mixture of vaccines? In other words, they can have Comirnaty and then CoronaVac. First, I'd like to talk about the 2 new death cases, the 9th and the 10th. Both received CoronaVac vaccines. As for your second question, this has to do with the Comirnaty vaccination program? I will not be answering that question because this is outside the jurisdiction of our committee. As to whether people can receive a booster shot more than 42 days after the first shot, I think it depends on the circumstances. But we have not discussed this because this is not within our purview. However, I can say this. If you get a booster shot after 42 days, according to the third phase clinical report, there will be no effect on the effectiveness on the vaccine, and there will be no effect on the antibodies generation. According to a report in Lancet, it is said that if a booster shot is received after 12 weeks, it actually will produce a better effect than receiving it 6 weeks after the first shot. Another one? The lady on this side. I'm from Ming Pao. Like to ask about the 8th, 9th, and 10th cases. Is it that still you cannot decide whether it is directly related to vaccination? Is it, do you have any preliminary observation? Is it related to vascular or blood vessel problems? And also, how many adverse events have you looked into? How many are classified as consistent, how many inconsistent, how many indeterminate, and how many are unclassifiable? There was a woman policeman who received 2 shots and then she had an aortic aneurysm. And also, you have received how many epilepsy cases? Are they related to vaccination? And also, there were 2 nurses who were affected, one in Yen Chai, one in Eastern Hospital. Are they related to vaccination issues? Let me answer the question on the 8th, 9th, and 10th death cases. Let me repeat. The 8th case has to do with a male. Before he died, he was affected by diabetes, hypertension, and hyperlipidemia. We understand that he died suddenly. Upon arrival in hospital, he was not successfully resuscitated. Right now, we are still waiting for the autopsy report. Our preliminary assessment is that it is related to cardiovascular problems because he has that history. The 9th case is an 80-year-old female, and she is affected by diabetes and hypertension. She was discovered unconscious without any signs of life at home. There is an initial autopsy done, and she is affected by coronary disease, and she has cardiovascular problems. And we could see that there was the problem of arrhythmia and also heart failure. So she died. We initially think that this is not directly related to vaccination. As to the 10th case, the history that we know is that since this was only reported today, this person is affected by hypertension, hyperlipidemia, and also some aorta problems. We understand that before he went to hospital, he mentioned that he felt unwell in the chest. But after some time, his family members found that he became unconscious. We believe that his death is related to cardiovascular problems, but we need to have more information and also the autopsy report before we can come to a more clear and assessment. But now, because of his history and also the information available, we suspect that he died from cardiovascular problems. As to the 50-year-old woman policeman who had a cerebral vascular stroke, her condition was not related to vaccination. As to numbers, let me give you these numbers for reference. Until the 21st of March, we received 793 adverse events reports. With regard to CoronaVac, 591, taking up 0.2% of total people vaccinated, and Comirnaty, 202 cases, or 0.17%. 445 involved hospitalization, 295 were males and 186 were females, and they were from 21 to 96 years old. You asked us whether we discussed any causality issues. We discussed 11 reports involving 15 cases today. 8 were inconsistent. 5 were consistent, and 2 were not classified as adverse events. Next one. Sorry, speaker not coming through. We don't have any information. No information either. The one in checkers, the lady there. Good evening. I'm from Now TV. In recent times, with regard to reported cases of hospitalization, many people had fainted because of vascular problems. And also, yesterday there was a case of having received CoronaVac, and that person's vision field was narrowed for 10 minutes. Did you discuss these issues? And also, the person who fainted in the car and died on the 19th, this is the first case involving Comirnaty. Can you tell us more why you think that this is not related to vaccination? Since it is an mRNA technology platform vaccine, would there be a special effect on people who have vascular problems and who may suffer from diabetes and hypertension, etc.? And also, if people have to wait long, say more than 42 days, to receive a second shot of Comirnaty, what will be the effect? Let me talk about Vasovagal Attack. Actually, this is quite common with regard to vaccination, because this has to do with a person's nervousness. If people really fear getting a shot, then this may happen. People should just lie down for a while, and then there will be recovery. In fact, we will not discuss this as an adverse event. As the narrowing of the visual field, we don't have such information, and it has not been submitted to our committee for discussion, so we don't have the information.
You mentioned about the 66-year-old male with diabetes, hypertension, and hyperlipidemia who received a dose of Comirnaty and later died. The information we have so far is that he is suffering from diabetes and hypertension as well as hyperlipidemia. They are rather serious. As he died before he was admitted to hospital, we don't have any other clinical information to rely on. We know that there was some resuscitation done on him. We have to wait for an autopsy. So we don't have any information in this regard. Looking at the cases of adverse events or fatality following immunization, we found that for a number of cases, the patients suffer from serious illnesses, say, for example, cardiovascular diseases. That's found at the autopsy. So we think that that might have to do with the heart diseases. But we need to have further information before we can conduct the causality assessment. In relation to 42 days, we don't have any reports or any such information relating to antibodies. However, in the latest publication in a journal, if it is someone who contracted the illness, if you receive a dose 6 months later, a dose of vaccination, the production of antibodies compared to someone who has not been affected is higher. So if you wait for a longer period before you get vaccinated, it doesn't necessarily affect the production of antibodies. However, we need more data. Next question, the gentleman over there. I'm from Hong Kong 01. First, just now you said that there was a discussion at the committee about 11 cases. 11 of the you have discussed about 11 cases. So how many and 5 of them are consistent? Can you give us more information? There are quite a number of people who have lost consciousness or suffer from some kind of discomfort right after immunization. Loss of consciousness, is it a normal reaction? Or is it because of the health condition of the recipient? It's said that there are defects with the cap of Comirnaty, the cap of the vial containing Comirnaty. People who have received a dose of Comirnaty, do they have to look out for any special health conditions? Do they have to be careful about certain things? In the committee, we have looked into 11 reports and 15 incidents. For consistent cases, there is a 67-year-old female who received a dose of a vaccine. She felt a headache, dizziness. She had a fever as well as chest pain. Well, we applied the WHO algorithm. The lady has a good health, is not allergic to drugs or the vaccine. There are common reactions or side effects listed in the product information. The committee is of the view that this is consistent with causal association. It's Comirnaty in relation to vasovagal shock. It is a common reaction if you receive an injection or inoculation. It's just a natural reaction of the body and will not have any long-term effects. In relation to the defects at the cap of the vial, I believe that it has no impact on the quality of the vaccine, so recipients of vaccination should not get too worried. Next, the lady over there. I'm from RTHK. I'd like the confirmation. Just now, the professor talked about the 8 reported cases. There is a 66-year-old male who died after receiving a dose of Comirnaty. Just now, the committee said that it may not be linked to vaccination or is not linked to it, because if it is the case of may not be related, then it may be related. I'd like to talk about the problem with packaging of Comirnaty, as well as the numerous cases of adverse events after immunization of Sinovac. Do the experts think that the expansion of scope of eligible people for vaccination should be halted? Well, just now someone mentioned about mixed doses. Those who have received the first dose of BioNTech, would you say to them that they should wait for the second dose of BioNTech, or they should get a mixed dose by getting the second dose in the form of Sinovac? I mentioned that patients suffering from diabetes, hypertension, as well as hyperlipidemia. From the information we have, we think that the death of that male may not be related to vaccination. But we need to reiterate that we have to wait for the autopsy report before we can determine the direct cause of death. But we believe that it has much to do with the coronary vascular diseases. Well, in relation to the cap, I've said that is not related to the quality of the vaccine, so you don't have to wait for 42 days. I think the immunization program of Community will resume. The study on mixed doses is a clinical study. We don't know the outcome yet. We want to make a comparison of the 2 doses of the same vaccine or 2 doses of different vaccines. This is a clinical study. It's not the case that we will launch it in the market for members of the public to use. This is just a clinical study. Sorry, speakers off mic. The speaker is not using the microphone. Expanding the scope of eligibility for inoculation, it has to be done step by step. Currently, it's expanded to those over the age of 30. I think that, it can be further expanded to 18, those between the age of 18 and 30. An English question, please. One at the back.
Several English questions from RTHK English News. First, on the latest death today, this morning, can you guys tell us a little bit about the likely cause of the death according to preliminary investigation, and why is it unlikely to be linked to the vaccine the patient took? Second question, among the 11 reports examined today, there was this one case found to be linked to the vaccine. Can you tell us the details of that, and how is that connection established? Third question regarding the BioNTech jab. Professor Hong, you kind of mentioned that there probably is no need for, you expected that the injection of the BioNTech can kind of start without the wait for, the 14 days limit to kind of come. Why do you think that? And according to the package design right now, do we have other features to prevent contamination for the BioNTech jab, even though the packaging will have some defect this time? Thank you.
So maybe I first answer your question about the today reported case of death. He is a 60-year-old gentleman who had history of hypertension, hyperlipidemia, and carotid artery disease. On 23rd of March, he has chest discomfort, and then in the early morning, he was found unresponsive at home and has been resuscitated and certified death at the A&E department. Based on his medical history and the symptom, we believe that there may be a high possibility of the cardiovascular disease leading to his death. But certainly, we need to go for, need to obtain more information, and also may have the post-mortem report to make sure that what is the cause of his death. So that is your question on the first case, on the last case, 10.
So with regards to your question on the BioNTech vaccination, based on the current data, I think most of the problem is a slight defect on the so-called the cover of the vaccine. So there is no evidence of contamination, and also there's no evidence that the quality of the vaccine is being affected. So we believe that there's no safety issues on that, and hence we believe that the vaccination program will restart very soon once this is settled. So in other words, I don't think that those who have received the first dose of vaccine have to worry about postponing further than 42 days for the second dose.
So regarding the expert committee evaluate 11 reports today, it covers about 15 events. So altogether, we have 8 find to be inconsistency with the vaccinations. And as well as we have 5 cases which 5 events which consider as consistent with the vaccination, and 2 are disqualified. So for the consistent case, I just give you one example. Is a 67 female. She received Comirnaty vaccines for 1 day, and then she experienced dizziness, headache, fever, and chest pain. So and also we checked with her medical history and found she had a good past health, no regular medications and follow-up, and also she had no history of allergy to drug or vaccine. So based on the WHO algorithm, we check about the side effects happen on these vaccines. So at the end, the expert committee considered those events are consistent with the vaccination.
下一個提問，問到個英文問題。
One more English question.
Hi, good afternoon good evening from SCMP. As Hong Kong's economic recovery depends largely on the vaccination drive, and given that of the recent deaths and also the packaging issue, do you see the vaccination drive as a setback to Hong Kong? And will you also discourage people with underlying health issues to prevent themselves from taking the vaccine? And also, although the government has stressed that the defected vaccine is not a safety issue, but is there any, what if the biotech vaccine program is deemed to be serious or dangerous after the investigation? So what will the committee do about that? Thank you.
So I think it's very minor hiccups in terms of the vaccination program. Judging from the current reports on the BioNTech, it's likely to be a minor defect on the top or the lid of the vaccine. So it's unlikely to affect the vaccination program in the long run. So I think once we have sort this incident out and also confirm that there's just a minor defect, I'm sure that the vaccination program will resume as soon as possible, and it will be very quickly, the confidence will be back to its usual or just as before the incidents. In terms of the chronic illness, I think we recommend people who are in the at-risk groups or patients who have chronic illnesses to get vaccinated. But of course, as we said before, we recommend people with symptomatic or uncontrolled chronic illness to seek medical help, and also to control their chronic illnesses before getting the vaccination.
下一個提問，
Next question. The gentleman in the front in a green shirt. I'm from Apple Daily. First, the 5 consistent incidents. You mentioned a female. Does it mean there are 4 other patients, or is it that the same patient, just one patient, has 5 symptoms which are consistent? As for the 67-year-old female, in which center did she receive the vaccination, and when did her symptoms appear? If the symptoms have been decided as consistent, then what would be the next step? Does it mean that she can apply for reimbursement from the indemnity fund, or what? As for facial paralysis, can you tell us about the background incident rate? Say how many people in what time of day had this problem. And you said that about facial palsy, you still have to collect data. Now, what data do you need in order to determine whether it is related to vaccination? Today, there is a case reported in the press that 30 minutes after getting the vaccination, the person fainted outside Cheung Kwan O Sports Center. The person was sent to hospital, and then when the person recovered from his or her dizziness, it was found that there was a facial paralysis case. When you say the companies could reward the product insert, does it mean that there is this possibility of Bell's palsy? This morning, the government was very determined to stop the immunization program about Comirnaty, but you have also told us about many side effects. This is one after another, but not necessarily there is a chronological association. But then since there have been so many things happening, why is it that there is no recommendation of stopping the immunization program? Because you have done so many announcements, how can you still reassure the public that vaccination is okay? Let me first add to what I said. I said there were 11 reports involving 15 incidents. And in other words, there is a report involving more than one incident. I talked about the 67-year-old female. She got a Comirnaty vaccine, and she had dizziness, headache, fever, and chest pain. So the committee did a causality assessment independently of each event. As for another case which was considered consistent, it involved a 52-year-old male who got a coronavac. He showed some allergy reaction, but we checked and it was found that he was not allergic to any drugs or vaccines. And according to the WHO algorithm, we found that this was consistent with the side effect of the vaccine. If it is Comirnaty, the shot was received on the 14th of March at the Lai Chi Kok Sports Center. And the other one, the 52-year-old male, he got a coronavac at the Honji Sports Center. That was on the 16th of March. The Expert Committee on Clinical Events Assessment following COVID-19 immunization, talking about the indemnity fund, the case must be certified by a registered medical practitioner. And secondly, when the case is submitted to the committee, there is no way to rule out that this was not related to vaccination. So that's another mechanism. We will deal with it when we receive an application. Sorry, speaker's off mic. Well, I think there are two scenarios. That document has to do with 15 adverse events following immunization which cannot be expected. And there are 46 other adverse effects or events of interest. We got information about people over 16 between 2018 to 2020. And on the average, there will be 110 new cases of Bell's palsy, meaning 1.67 cases every 100,000 population. But we do not have data from private hospitals. Therefore, the baseline should be lower than the actual figure. If we should find that statistically the figure is high, that is higher than the baseline and over a prolonged period of time, say 3 to 6 months, then we will make a recommendation to the Expert Committee on Vaccination and also the Food and Health Bureau. And we may recommend to the pharmaceutical companies that they reword or modify their product explanations.
I think you will see if it is related to the baseline figure, whether there is a significant differential statistically. Sorry, speakers off mic. The speaker is not using a microphone. We can't just look at it as an individual case. We have to observe over a period of time, compile statistics before we can make a comparison with the baseline figure. Next question, the lady over there. I'm from TVB. I'd like to clarify the 8 inconsistent cases. Are they the death cases, excluding the case in which the cause of death is not determined? In relation to 5 consistent cases, you've covered 2. Are they included in the 5 cases? I said 11 reports, 15 incidents, and they do not include death cases. We have received a number of adverse events. We will conduct the assessment independently. 5 consistent cases. I've covered 2 reports. One is a 67-year-old female received a dose of Sinovac. After a day, there is a dizziness, chest pain, fever, as well as headache. And the other one is a 52-year-old male receiving a dose of Sinovac. After 27 minutes, and there was allergic reaction. Sorry, speakers off mic. The speaker is not using a microphone. 8 cases, 8 inconsistent cases. Well, they're rather complex. I'll just cite one example. In general, when we receive a report, we see whether the dose is a vaccine, and then the condition of the onset. Say the 50-year-old male receiving a dose of Sinovac 8 days later, he claimed that his blood pressure is not normal. He suffers from hypertension and he's on medication. So we look at the background, we look at the patient's health condition. Experts will take that into account and consider whether the health condition is related to vaccination or his own illnesses. In the end, we've decided that it's not related to the vaccine. What about those who haven't asked questions? The reporter over there. I'm from the Oriental Daily. How do you consider that the case is not consistent and then that is not related to vaccine? What about the 66-year-old death case? There is diabetes, hypertension, as well as hyperlipidemia. How come he was allowed to get inoculated? Under the monitoring mechanism of adverse events, we have a mechanism in place to receive reports, and under the recommendation of the WHO, there is an active report. We work with the Hong Kong U. We obtained data from hospitals to see the incidence rate amongst hospitalizations relating to vaccination. As we've said, when we have received a report, we will have to conduct a number of assessments. From the reporting doctor, we have to find out when was the inoculation, the batch number, and the brand. We also ask about medical history of the patient, whether the patient is on any medication, and what happened during the symptom onset. If need be, we will obtain tests. Say, for example, Bell's palsy cases, we suspected of a cerebral stroke, so we would ask for an MRI. If we suspect that is related to the vaccines, we would obtain the information from the pharmaceutical companies to find out whether there are similar cases in other places of the world. We'll also check the data bank of the WHO about similar cases. Data is being built up in relation to COVID-19 vaccines. We're also compiling statistics relating to conditions like Bell's palsy. We need to compile sufficient amount of data. We have to check against the background incident rate. If there are safety alerts, then we have to take action. Say, for example, we ask the pharmaceutical company to take the initiative to conduct clinical tests to prove that it is not related to vaccination. And they can also take precautionary measures, say, to issue a warning. Like in the case of Comirnaty, in the product information you'll find that Bell's palsy is a rare side effect. The most severe case is that should we spot a major safety alert, we will have to halt the immunization program. So far, the expert committee has not identified any major safety alert. Say AstraZeneca. The program was halted because there were problems identified relating to embolism. They had to conduct research and tests. If they find that there is a high risk, then they have the responsibility to halt it before safety is proved. Last question before we end. The 700 cases or so, you mean from the start of the program? Well, there are 71 cases before the 7th of March. And you talk about 11 reports. So far, how many of them are consistent, inconsistent, indeterminate, and unclassifiable so far? The 9th death case, why would you delay till today to make an announcement? Are there problems with any delays or missed notification? It said that you have to wait for 6 months to make a comparison with background incidence rate. Should people be worried because there will be a lot of people who have been inoculated, and for people who suffer from Bell's palsy, the damage is done. Would you be able to compress the time? Well, since the 26th of February, when the program started, to the 21st of March, there are 791 adverse events. For Sinovac, it's 591, Comirnaty 202. Comirnaty started later.
You asked about causality assessment. Last time we did 6 involving 8 cases, and this time 11 involving 15 incidents. We use the information and data we have so that we can do an assessment. We actually discussed this, and if there will be a lot of data, the causality assessment might have to be done a different way. So these may not be the final figures. About the 9th case, I think we mentioned it in a previous press release. The purpose today was to do a causality assessment, but we also reviewed the death cases. So with regard to the 9th case, there is an initial autopsy report which showed that this lady had cardiovascular diseases, and she also suffered from heart failure, and also there is a suspicious arrhythmia case. This is what we have, the information at hand. As for Bell's palsy, we know that from overseas reports, Bell's palsy that is related to vaccination would have a 70 to 80% recovery rate. If we find that the base figure is abnormal, we will not wait for 6 months to publish it. If we should see it within 2-3 months, we'll definitely publish it. The press conference ends here. Thank you very much.